Okay, hello everyone. I am going to go over Chapter 7, the skeleton and bones today. And I would like to just let you know that not all of this chapter you will be responsible for. And let me just kind of give you an overview of that. You will need to know the bones, the structure of tissue cells and marrow of the bones, and basic information about growth, ossification, and how long bones are formed and resorption. You'll not need to know about the markings. You will be responsible for the axial skeleton and the bones within the skull, the trunk, and the thorax. The appendicular skeleton, the upper division, which is the shoulder girdle and the upper extremities, as well as the lower division, the pelvis and the lower extremities. In terms of joints, we will go over the different types of joints, and which are the synarthrosis, the amphiarthrosis, and the diarthrosis. As far as aging and disorders, we will be eliminating that. Some of the key terms that you will need to be responsible for, again, paying particular attention to those things that we will be covering and you'll be responsible for. So the skeletal system itself is obviously made up of bones, joints, and its supporting connective tissue. And remember that the skeleton bone is a type of connective tissue, and it's very hard. When we look at the skeleton as a whole, we have both the axial skeleton and then the appendicular skeleton, which consists of our arms and our legs. So some of the things that we'll be looking at is the function of bone, and if you consider the function of bone, there are several functions. Some of the things that they do, there are about 5 of them. And then in terms of describing what a long bone consists of, and then the 3 different types of cells that you find in bone and what their functions are. And then describing or differentiating between compact bone and spongy bone in regard to their structure and location. I do have a video that I have uploaded to the module about how long bone grows, and you will not be responsible for the markings. You will be responsible for some of the location and the description of some of the bones in the axial and the appendicular skeleton, as well as the normal curves of the spine. You will not be responsible for any of the bone disorders nor the 8 types of fractures. I figured that you had received that information in probably one of your EMT classes. Okay, and joints, we'll be looking at those as well. So the function of bones, there are 5. And then again, we'll be describing the structure of the long bone and the different types of cells that you find in bone, and be differentiating between compact and spongy bone in accordance with their structure and their location. So the 5 things that bones do, they act as a framework for our body. They protect our delicate structures like our brain and our spinal cord, our heart, and our other organs. They do work as levers along with the muscles to produce movement. They store calcium, and they do produce blood cells. So when we look at the bone structure, it is composed of 2 areas, the diaphysis, which is the shaft of the bone, and then we have the epiphysis, which are the ends of the bones. We find marrow inside of our bone. The red bone marrow is found at the ends of the bones, and that's the epiphysis, and then the yellow marrow is found within the shaft of the bone, the diaphysis. We have some membranes that cover the bone, and they are living tissue. The covering of the bone is the periosteum, and then inside the cavity of the bone is the endosteum. And then, of course, we have two different types of tissues in bone, the compact and the spongy. So here, when we look at the long bone, we have the spongy bone, which very much looks like that along the proximal epiphysis. So these heads are called the epiphysis. Then the shaft itself, all of this on the long bone, is called the diaphysis. And so remember that the proximal is closest to the body. So this is the femur, and it would be closest to the body and attached to the hip. And then down here would be the diaphysis, the distal epiphysis, I apologize. But covering the entire bone, except for the portion where the joint is a covering called the periosteum, and you see that there. And then within the bone itself, there's a shaft. And in that shaft, we have yellow marrow, which is primarily fat. And this is all compact bone along the area that is the long bone along the diaphysis. In the epiphysis, where we have the spongy bone, we have red bone marrow, and that's where many of our blood cells are made. And we have a growth line, which you can see here, which is indicative of where growth occurs. And you can take a X-ray and find exactly how much growth has occurred or will be occurring, depending upon how this growth line, how marked it is. And our long bones continue to grow from the time that we are infants all the way until into our 20s. So, and for men, it continues to grow into our later years in our 20s, whereas for women, they stop growing earlier in their 20s. But along the interior of the long bone is another covering, which is called the endosteum. So along the outside, the covering of the long bone is the periosteum. Along the inside is the endosteum. Compact bone is all along the shaft or the diaphysis of the bone. The bone does have an artery and vein as well as a lymph system that is there. Covering the joint area is cartilage. So that is not capable of being reproduced. So once you lose that, if you have some osteoarthritis, it is gone. It is not capable of being replaced. So when we look at the bone tissue itself, we have osteoblasts, which build bone tissue. And the way that I remember these three different types of bone cells is osteoblast build, blast build. Osteocytes are the main bone cell itself, and then osteoclasts. They are responsible for breaking down bone tissue, and then and that's called resorption. So there are areas of the bone where it gets broken down, and then like maybe due to damage, like damaged bone tissue. And then what happens is that that bone that has been broken down by the osteoclast is being remolded to form new bone. So this process occurs whenever there is damage, or if bone just needs to grow. So when we look at the bone itself, And this is just a section of the bone. So if you look here, it looks sort of like a tree or with tree rings. And so these bone cells are actually found within these little sections here, and those are osteocytes. And then embedded in that those osteocytes are these areas that are called lacunae. And so you can see them here, these dark areas, and inside that you have your osteocytes or the bone cells. We have a central canal that is here and here, and if you note, there is an artery and a vein that run through that. And then from one osteon, and this is this circular portion here, which is forming the bone tissue itself. They are connected or interconnected from one osteon to the next osteon by these perforating canals. And so they allow for the blood flow to back and forth between those. So it allows for calcium to be resorbed and other minerals like phosphorus and magnesium to aid in bone growth. And then some of the other terms here that that you might consider is that, so here, these big rings are the osteon, and that has within it, if you look here, all of these little star-shaped things are the osteocytes, which are the bone cells. They are located within the lacunae, and these lacunae are these dark spots. So inside those dark spots are the osteocytes, okay? And then we have within each of these osteons, one of these big rings, we have a canal, and that central canal has an artery and a vein because, you know, blood is tissue and it needs to be nourished. And then along the outside, we have the periosteum. So, so when you look at this, we have a full cross section of a long bone here. And each one of these sometimes are called a Haversian canal, where you have the artery and the vein within that. Sometimes they just call it the central canal. So, so the cells that are located in the spaces of compact bone are osteocytes. So compact bone has osteocytes. And then some of the things that you need to go back over, just sort of look over these checkpoints and review them. Now, how long bone grows is something else that we'll be looking at, but we will not be concerned with the markings on the bone. So long bone is formed at the epiphyseal plates, and that's at the ends of the long bone. The bone resorption means that it's being broken down. Bone is being broken down, and as I said, that could be due to damage or repair. And so what happens is as that bone is reabsorbed, it has to have a means by which it can be reabsorbed. And some of those cells that do that are called osteoclasts. And so they resorb that bone, and then they distribute all of the minerals back to the areas where bone formation would take place. So those are types of bone cells. The osteocytes, those are, osteo means bone, cell for sites, and they maintain the repair of any existing bone. And then the osteoclasts are the ones that break down and resorb that bone tissue. They're sort of like little Pac-Man. And then ossification, that term means that it is, that bone is forming, so it's changing from cartilage to bone, and cartilage is found in infants, and it continues to form bone, as I said, all the way up until your 20s, when you get the bone fully formed. So how the long bone is formed, we have these centers of ossification, and all bone in infants is cartilage, and it's very, very pliable, and then it begins to turn to bone, and so as we begin to walk, and the fontanelles, those soft spots on the top of the skull of a baby begin to form or close, and then the bone itself of the cranium becomes ossified. All of those things are occurring from birth all the way up to the time that we are in our 20s. But so how does the bone grow? Well, the bone grows at these plates that are at the ends, which are called the epiphyseal plates. And so it's a line along the end of the bone, and the cartilage is being laid down. And the bone is being laid down at these epiphyseal plates, and it grows longer. So it expands in length. Not only does that occur, but the bone is also expanding in the midline along the diaphysis, and it gets wider. And so the bone continues to form, and so as this occurs, it, as I said, continues all the way up into our 20s, and until we see the epiphyseal plate become the epiphyseal line. And you can see that as a distinguishing mark in an X-ray to show that the bone has been fully ossified and completed its growth. But bone resorption, why do we need to break down bone? Well, it's, as I said, it is necessary for any repair for bone injury. And then also sometimes the body needs some of the stored minerals that are found in the bone, like calcium, for nerve transduction or for muscle contraction. So these are some of those bone markings that I'm not asking you to be responsible for. But what are the centers for the secondary growth of a long bone? And again, that's along the diaphysis. And then we're just going to move ahead. All right. So which protein makes up a major component of the bone matrix? And that would be your collagen. Where does bone growth occur in children? And that's along the epiphyseal plates. Now, these are some of the bones of our face, and you are not responsible for these, but it allows for the sinuses to give a lightness to the head, and allows for us to hear our voice, and so that it's a lighter sound. And when we look at our bones, they are found in two different distinct parts: the axial and the appendicular skeleton. And then we also have some normal curves in our spine. So we have two main groups of bones. The axial skeleton has 80 bones for the head and the trunk, and the appendicular has 126. In total, there are 206 bones. So these are all of the bones of the skeleton, and how many there are. You're not responsible for all of these, but I will go over the ones that you would be responsible for, and continuing along all of this. So when we look at our skull, there are some accessory bones like the ear ossicles, which are, the malleus, the incus, and the stapes, the hyoid bone, which is our Adam's apple that connects to our tongue. We also have some sutures that are joining bones together in our skull, and those are, of which there are three: the coronal, the squamous, and the lambdoid suture. So when you look at the bones, these are flat bones that are found in the skull. You should know all of the suture lines. Between the frontal bone and the parietal bones, that's the coronal suture. And then between the two parietal bones and the back of the head, which is the occipital bone, is the lambdoid suture. You should know that we have the maxilla and the mandible. The mandible is the only movable joint or bone in our skull. So again, here is an infant's skull, and as the bone is being formed, these suture lines are then closed, and it allows for the sealing of these areas, which were meant during childbirth for the head to compress and to come through the birth canal. And of course, the largest fontanelle is the anterior one. So then when we look at the trunk, we have the vertebral column, we have the cervical vertebrae, and then so for the cervical vertebrae, we have 7 of those, and then the thoracic vertebrae, we have a total of 12 of those, and then we have the lumbar vertebrae, of which there are 5, and then the sacrum. In children, these are separate bones, and there are 5 of those, and then our tailbone, which is the coccygeal bone, and that has 4 or 5 of those. So when we look at the vertebral column, you should know each one of the cervical, the thoracic, and be able to label them: the lumbar, the sacrum, and then the coccyx. In terms of all of the processes and all of this, I'm not holding you responsible for it. However, you will be responsible for the 2 first cervical vertebrae, which is the atlas, which holds our head, and then the axis. The axis is sitting on is sitting upon the axis, and it has this process that allows for our head to turn from left to right, like we were saying no. So those are important cervical vertebrae that you should know. In the thorax, we have the sternum, the ribs, and the ribs have both true and false ribs. And then our breastbone has the manubrium. We have also our clavicular notch and our sternal angle and our xiphoid process, which are all part of our breastbone. So if we look here, and you should be able to note all of these markings and identify the bones in the thorax. So we have, starting with the breastbone itself, we have the manubrium, and it looks like a kind of a T shape, and then we have the body of the breastbone, and then we have the xiphoid process in children that is made of cartilage, and then it gets built into bone. So if we look at our ribs, there are a total of 12 ribs, 10 of which are attached and then 2 that are floating, okay, the 11th and 12th. So, and then here, when we look at the true ribs, we have 7 of them. So there's, you know, starting from the top, from the manubrium, we have 1 through 7, and they are attached to the costal cartilage here. These, the 8th, the 9th, and the 10th are false ribs. They come and 11th and 12th, but sometimes we are distinguishing between the false and the floating ribs. The false ribs being the 8, 9, and 10, and then the floating ribs being the 11th and 12th. But in reality, the 8 through 12 are all the false ribs because they are not connected to the costal cartilage directly like the first 7 are. And let's just move on. Which bone forms the back and part of the base of the skull? So the back would be the occipital bone. And as I said, you should know the bones of the head, and then also the suture lines. Okay, in terms of the appendicular skeleton, we have the shoulder girdle, which consists of the clavicle, which is our collarbone, and then of course we have the scapula, and then that is attached with the humerus, and we have a point of juncture which is called the acromion, which has the attachment to our humerus here, and you can see it here where we have our clavicle, and then the acromion, which is the back portion of is attached to the clavicle. This acromion is being attached to the clavicle, part of the scapula. In terms of all of the markings and the names for all of these little parts of the scapula, I'm not concerned about your knowing those. And when we look at the appendicular skeleton as well, we have our upper arm, and then our forearm, and our upper arm has the humerus, and then the lower arm has the radius and the ulna. When we are aligned in the stance of being with our palms up, we have the ulna is on the medial side, and the radius is on the lateral side. So if you look, these have the palms up, and then the radius is on the lateral side, on the outside, and then the ulna is on the inside. So when we change our forearm from the supine to the prone, the radius and the ulna actually cross over. So the radius, again, if you do this, the radius is in the supine position is on the outside, on the lateral side, and then on the medial side is the ulna. Okay, and we have here our ulna is fitting into our humerus, and if you go back and you look here at your humerus, where this forms, the ulna sits in this notch called the olecranon fossa, and a fossa is like a little depression. So it's sitting right in here. That's where our ulna is attached, and it makes up our elbow. So, and you can see it here in this X-ray. In terms of the bones of our hand, we have, of course, the carpals, the metacarpals, and then the phalanges. Okay. I'm not asking you to know all of the little tiny bones in the carpals, nor any of the nor those for the metacarpals, and then the phalanges. Just know that there are three phalange bones in our fingers. In our thumb, there are only two. Okay. The pelvis, it has both the ilium and then the ischium. The ilium is this portion that's in kind of like an orange. The ischium is this portion that we sit on. And then we have one on each side of the pelvis for those bones. And then this pelvic cavity is sitting within this area that houses the sacrum and then the coccyx. So it comes down through there, and you can see it here. Okay. We do have the pubic symphysis, which joins the two pelvic bones on both sides. This is capable of stretching and becomes more flexible when a woman is pregnant in order to give birth to the baby. And if there are differences between a male and a female pelvis. The pelvic arch in a male is not as wide. Also, the ilium for the male is not as spread wide either, and as well as this area here, which is the center portion, and that housing the ischial spines on the back here, which you can't really see, but right here and here. But that is smaller in a male. So again, here's the comparison of the male and the female pelvis, and you can see that the pubic arch is not as wide in the male as in the female. That pelvic inlet is wider, and then the ilium is actually wider and broader. When we look at the bones, continued of the lower extremity, we have the femur, and the femur has a head and a neck which is attached to the pelvis, and it's actually attached. They don't label it here, but to the acintibulum. Oh, yeah, they do here, right here. So the head of the femur fits into the pelvis there at the acintibulum. And then again, we have these condyles, which are these protuberances on the back of the femur, and that's the medial and the lateral condyles. Then on the bottom extremity of the leg, we have the tibia, which bears much of the weight. And then this is the fibula. Okay. At our ankle, we have two different surfaces which lend themselves to be the ankle bones. In the fibula, it is the lateral side is the lateral malleolus, and then on the femur is in the medial side, towards the interior, or the midline of the body is the medial malleolus. So that's part of our ankle. Our bones of our foot are of course the tarsal bones, the metatarsals, of which I'm not asking you to know all of them, and then the phalanges again. I do expect you to know the calcaneus. That is the heel. And here, which of the following bones is found in the shoulder girdle? So of course in the shoulder we would have the scapula. And then the 5 types of bones, which we're not going to be responsible for, and the types of fractures, I'm not going to hold you responsible for those either. These are the types of fractures. Now, when we look at joints, there are different types of joints. An immobile joint or an immovable joint is a synarthrosis, and that is made up of fibrous material, and we find that in our skull. That's where our flat bones of our skull are joining together these fibrous joints, and obviously we cannot move the bones in our skull. Those are synarthrosis, the type of joint. Slightly movable joints, which we find where there's an articulation of cartilage, and that would be like in our vertebrae, that those are known as amphiarthrosis, and also in our pubic bone, where the pubic symphysis of the 2 pelvic bones come together. And then the freely movable joints are known as diarthrosis, and that's like our knee, our elbow, our shoulder. So when we look at those synovial joints, they have ligaments, they have a joint capsule. The cartilage is considered to be hyaline cartilage. They have meniscus, which is made out of cartilage as well, and you have probably heard of those in your knee. And then, of course, there's fat, and then there's the bursa, which act like a cushion, and that you can find in our shoulder. And then when we look at a synovial joint, a synovial joint allows us to have much movement and flexion, extension of our limbs, as well as rotation, abduction and adduction. So here are some of the articular surfaces and membranes that are housing the knee joint. So when we look at these synovial joints, as I said, it allows for us to move and have great mobility. Flexion is when we can, flex our arm and bend it. And then when we do this, we are moving it either towards, bending it towards, or away from our body. And extension is when we extend the arm out, when we are going from a bent elbow and then extending it and straightening it. Abduction as compared to adduction. Abduction, we are moving, and I think we have them here, yeah. Okay, so the abduction is moving the arm out from the body, from the midline, and then adduction, we're moving it back towards the body. Flexion and extension, if we take our hand and we open and close it, we can flex it by closing it, extending it, in opening it. Inversion and eversion, that is moving like our feet toward or away from our median or our medial side. Rotation, of course, is like moving our head from back and forth. Dorsiflexion and plantar flexion. Our dorsiflexion is when we straighten our foot towards the leg, and then plantar flexion is when we are pointing our toes like a toe dancer. And then, of course, circumduction is moving our arm completely in a circle. And then pronation is where their palm is down, and supination is where it's up. These are all of the movements of synovial joints, which are completely movable. So when we look at the different types of synovial joints, we have the gliding, the hinge, the pivot, the condyloid, the saddle joint, and then the ball and socket. I'm not asking you to know the different types of synovial joints. I'm just asking you to know that synovial joints have movement, and that you should know these types of movements. Okay. As I said before, I'm not asking you to know any of the disorders of the joints either. And I think that is it in terms of Chapter 7 on the skeleton. I hope that you have a good day, and I'll see you with Chapter 8 on the muscular system.